Hypochondria. What is hypochondria? Hypochondria is also known as illness anxiety disorder. Hypochondria is the fear or belief that one has a serious medical illness despite having little to no symptoms. Around 5% of people in the United States have hypochondria. Many times it starts in a person's 20s, and it can be triggered by a medical scare or a serious medical illness of a friend or relative. How it affects them. People who have hypochondria fear normal functions. For example, sweating and rapid heartbeats might make them think those are symptoms of a serious illness. They also fear minor abnormalities, such as a runny nose or a small sore. People with hypochondria feel like these are serious health issues. They regularly check their body for any signs of illnesses and check the internet for symptoms of serious illnesses. Some may avoid people and places that they believe could possibly be risky for their health, and some may avoid going to a medical professional in fear of finding out they have a serious illness. They might not be relieved if a test result for an illness comes back negative, but instead become more concerned. Treatment. For a hypochondriac to start treatment, they need to recognize they have a problem, and they need to commit to healing the problem, which is difficult for them because they believe there is a physical connection when there is none. Cognitive behavioral therapy is one treatment method. When dealing with hypochondria, the focus is on two main aspects: cognitive restructuring and relaxation training. Cognitive restructuring trains the mind to replace negative thoughts with more positive ones. Relaxation training gives useful tools to fight their anxiety over a serious illness they believe they have. Selective serotonin reuptake inhibitors are a class of antidepressant drugs that can help treat hypochondria. Society's beliefs. Sometimes hypochondriacs are known to be uncooperative and difficult because they might not believe a doctor when they tell them they do not have a serious illness. Physicians can become easily frustrated with hypochondriac patients and often don't make an effort to tolerate and understand them. Sometimes this leads to physicians rejecting patients with hypochondria. Hypochondriacs sometimes are perceived as people who pretend to be ill for their personal gain. They are also used for comedy in the film industry and are portrayed as someone that is constantly worried about their health. Resources. Here are 2 websites for more information on hypochondria. Here are 2 psychotherapists near Highland, New York. Elise Manoz is a licensed CBT psychotherapist located in White Plains in New York City and has experience working with all ages. She uses both cognitive behavioral therapy and team CBT therapy, which was developed by Dr. David Burns at Stanford University. Dr. Peter Kaplan is a clinical psychologist that has over 20 years of experience. He has training in psychodynamic, family, and cognitive behavioral therapies. He is located in New Paltz, Poughkeepsie, and New York City.